7:31, so the Board of Health meeting is called to order. So the minutes from last month were distributed. Anybody have any additions, corrections, any issues? So could I have a motion to approve the minutes?
I make a motion to approve.
Second. So all in favor?
Aye.
Any opposed? No opposed. Minutes are approved. So we can go to Sam, to your report.
All right, so do a quick COVID update. Generally at the federal level, most things are coming down. Cases, hospitalizations, deaths, all trending downward. In Connecticut, in Fairfield County, we're remaining at the medium CDC level. And that's most likely due to the hospitalization trend for the last couple months is not, it's not trending strongly upward, but it's trending upward in Connecticut and Fairfield County. Since April, we've kind of had this upward trend. But generally, Fairfield itself, things are, aside from hospitalizations, things are trending downward. We're down to about 60 cases in the last 7 days, which is pretty low for us. But we are seeing activities in the schools and certain little clusters of activity. So we're keeping an eye on that. We still have our ELC1 grant funded contact tracers on board, and our EL2 grant coordinator is hired, and so she's sort of overseeing all things COVID for us. As much as possible. Jill can't resist herself and get involved, but we are, continuing with that activity, and all that staff has been trained on all the protocols for monkeypox as well, and so we're transitioning them to not only handle COVID but all infectious disease investigations to assist with that because, our day-to-day, we typically call salmonella cases and E. coli cases and Hep A cases and, all those things. We typically make phone calls and do interviews, the same thing that we did in COVID, but so we're just kind of doing that with them now to give them experience mostly because it'd be valuable for their careers, and it helps us out. From a preparedness perspective, we are participating, we're conducting a local exercise on the 19th, which is what's called the DEMIS, Department of Emergency Management and Homeland Security Field Day. And so this is a day down at Sherwood Island on the 19th where the state shows off all the toys that they've bought with the various federal and state funds, so there's lots of trailers and things like that. And what we're bringing that we've had for 15 years is our inflatable tent. So we have an inflatable 16 by 26 inflatable tent that we can set up. We've done drills and exercises, had our flu clinics in it multiple times. And so we'll go down and set that up. And in it, there'll be a sort of ongoing presentation about the Medical Reserve Corps in Fairfield County. But the setup and breakdown of that will be meet a contract deliverable requirement to conduct drills.
Is that open to the public?
So it's open to the public. The intent is really to be for first responders and elected officials to come and see the resources that are available in the region to help. So there's the things there's the mass casualty trailer. There's the decon trailer that you've probably seen it at the hospitals. They roll up and it's got showers and everything and so they have all those resources. They kind of bring it out, and it's show and tell. The hazmat team will be there. The regional communications vehicle that they have, which has all sorts of radio tech and satellites and things like that can connect anybody with anybody else. And so that'll be happening on the 19th at Sherwood Island, 11 to 2. Feel free to come down. There's pizza from Colony Grill there, so then that's not part of the federal dollars. So that's a donation. We'll also be conducting a drill this week, a call down drill that some of you are on our Medical Reserve Corps, so you get those calls. So get ready. You'll get another call this Thursday. We continue our work in terms of preparedness with our Medical Reserve Corps grant, working on doing a recruitment campaign and a training session coming up this fall. So that should be happening. We'll start that process. We started, but we'll have the more public aspect of it over the next few weeks. From our environmental program, we did have a vacancy that I think I've discussed before. Sanitarian, one of our senior sanitarians, has left us to become the assistant director for City of Bridgeport. And so we finally got the approval to post the position. We posted the position. We have to post it internally to the union members, externally to the public, and wait a couple weeks. And so that finally closed on Friday. And so now we can start the process of interviewing and get an individual into that position. And we did have a couple qualified individuals in the pool that we're happy about. And so we'll do some interviews and hopefully have that position filled by the time we have the next board meeting. One of the big changes in environmental health as well is the itinerant food vendor. I think we discussed it before, the changes in the state law. So that's really coming to head right now, where the state is going to be launching their website that shows, the complexity of it is that, the system they've put in place is a system where we sign this MOU. We discussed this. The board voted in favor of the town signing the MOU. I discussed it with the first selectwoman. She considered it, decided to sign it, and will be a part of the town's participating in the agreement. And that agreement will allow an itinerant vendor like a food truck or a hot dog cart, a mobile vehicle, to, if they're licensed in another town, that license is reciprocal to other MOU signers. So that website will be rolling out shortly, and that'll be the sort of official start of the program. So, when that rolls out, we may not, but we may see some additional trucks out on the streets, and it only covers them being on the streets, not temporary fairs and festivals, which we're now having to sort of revamp our website to say to the vendors that are coming to town, say, by the way, you still have to check with the police, and you have to get a vendor's permit from the police. They're not exempt from that, and have to follow the zoning regulations and Parks and Rec regulations and all those things. So we're having to revamp our website to make sure they still understand that, but we're underway of doing that. We continue with lots of housing and blight issues. So we issued 2 citations recently for blighted houses, and they've decided to appeal those citations. So we have 2 hearings this week, tomorrow, on citation appeal hearings, where we think the hearing officer will uphold the town side on it, but we'll see. But we've had quite a bit of activity with communications with various lawyers and the representatives of the owners who, hear one side from their clients, and we say, well, that's not quite what he told me, told me I'm not doing any work, period, and so we'll see how those hearings go, we also have a site visit with an owner and his attorney, trying to work it out prior to the hearing, prior to having another hearing. We also met with the Fairfield Beach Advisory Board, so that's an annual meeting we have. We have a series of meetings throughout the year, but in the end of August, we have a larger meeting where the Fairfield Beach Road Homeowners Association, the Peninsula Association, the town, the universities, all meet and have a discussion about how, what are the strategies being employed this year, and trying to reduce, nuisance type activities going on down at the beach area, so that the residents and the tenants of the various rental properties out of there can peacefully coexist. And so in addition, we had myself, the first selectwoman, the fire chief, and the police chief also met with the Fairfield Beach Road Association's annual meeting last week, and had a productive conversation about some of the strategies, and but we definitely hear some frustrations from them as well as about trying to improve conditions there, and frustration with why there's it doesn't feel like forward progress, whereas those who've been around a bit longer remember the larger clam jam parties and other things that were much larger events in the past that we've successfully been able to curtail a lot of that activity to more appropriate sizes and contained. And so, we definitely feel like there are improvements, but if you've only been down there for 5 or 6 years, it doesn't necessarily feel like that.
Are there representatives from Fairfield University and from Sacred Heart who are involved in those meetings? Because I assume it's
well, with
a good number of
the Fairfield Beach Advisory Board, yes, the university, both Fairfield and Sacred Heart universities are represented there, and and they're always there, and they, in some cases, will lead some of those meetings throughout the year. And they were at the meeting at the end of August. The meeting with the Fairfield Beach Residents Association, they, because it's their first week, they said we're inundated with on-campus activities, and so they didn't send a representative to that. So we continue to be busy in the beach area, doing housing inspections and getting the certificates of rental occupancies and all the inspections related to those processed. Flu and COVID activity, we are clinic activity. We're planning our COVID bivalent vaccine booster clinic coming up soon. We don't have the date finalized. We're kind of waiting on a few details to before we start promoting that. But that we hope to have a clinic by the end of the month. We have our flu clinics scheduled for the 13th and 14th of October, and so we'll start promoting those.
Are you not going to pair those together? Like, can we get both of the same offering to try to?
We're not. We're not going to do it this year. We just felt like the demand for the bivalent vaccine, it may be two different populations, and we felt like there's probably demand for the bivalent vaccine earlier. I mean, there's already clinics starting to offer it, and we think there'll be significant enough demand that it warrants having its own. We're going to do it. The plan is to hold it on Saturday, so that to be a better service to the community in that regard. So, but yeah, then a few weeks later we'll have the flu clinics down at the senior center on the 13th and 14th. And from a community health perspective, our Matter of Balance, we do a senior fall prevention program called Matter of Balance that is starting on the starting this month, and it's an 8-week program, and it's already full. So they're already looking to set up another one, maybe in the early winter or earlier midwinter. We are starting our Healthy Lifestyles program, which is a 13-week program. That's formerly the diabetes prevention program. And we are also we have a diabetes and chronic disease support group, which happens the second Tuesday of every month at the senior center from 1 to 2 in the afternoon. And so that is starting as well. I think that's starting tomorrow. And then Santina Duranco is working with the Health Improvement Alliance in our area, working on the community health assessment and the community health improvement plan, finalizing those, and we hope to have the first draft out within the next month or so. And so that will then influence, and what I'll probably do is before the pandemic, you guys remember that we approved a 5-year strategic plan, which then was thrown out the window. And so we will revisit that plan, potentially extend it, and incorporate this latest CHA and CHIP recommendations into that new strategic plan. And so it will probably be, it probably won't change much. The priorities typically don't change too much, in terms of what we're focusing on. But that'll be the plan. So that's probably what we'll work through once those come out publicly, then we'll work to incorporate that in the strategic plan. We'll bring that back here for your review and approval or consideration. And that is my report.
Quick question.
Sure.
Just in looking to kind of stay ahead and sort of pre-plan here, any talks of polio and preparations for that, education, looking at vaccination rates, things like that, with what we're seeing in New York with probable, cases that are kind of hiding in the woodwork, if you will, looking at, the rates that they're seeing, testing sewage water, things like that. There's probably a lot more out there than, the cases that have been reported already. Anything coming down from the state in terms of that at all, or not? I haven't heard any indications of the state that they're moving towards doing any kind of increased vaccination campaigns or anything like that. Or surveillance, or
well, the surveillance.
Or does that already happen?
The surveillance is always there. I mean, this is
So I guess that means surveillance more like, when you're doing things like testing wastewater, not so much case reporting, of course, that surveillance continues, but.
Yeah, I mean, so there is wastewater testing going on now, and I haven't heard of anything of adding polio to that, but I know our vaccination rate is, I forget, you had quoted me the number at one point that it was like, in the high 90s?
I don't want to say a number, but it's very, very high.
Yeah.
It's exceptional.
Yeah.
I will say, this is the year where incoming kindergartners who have had religious exemptions can no longer use them.
Right.
And our priority is to make sure those kids get vaccinated for polio. It's our first vaccine that we would offer them or suggest that they get, with their provider.
But at this point, there's been no discussions from that, on the state calls about increasing any activity related to that for local health departments.
You haven't seen anything in your ER?
I mean, just other than knowledge sharing, no, but nothing from a case standpoint, no.
Yeah.
Sam, thank you, that's great.
Sure.
Zach, that program about the helping elderly with balance, who runs that?
Dr. Durango, Santina runs that program. And so,
fantastic.
Yeah, so she's been doing that. She's a master trainer for that. So we sent her off to New Hampshire to become a master trainer in that years ago. And so she trains other instructors and then works with those instructors to offer additional programs. So at one point, the program, we had ongoing programs, at Fairfield U and other areas where we trained the student nurses and they would deliver the program out in the community. Since COVID, that kind of fell off, but that's the plan, is to ramp it back up. She's already trained Julie McCullough, our public health nurse, and Julie will be assisting her with offering the program. But it's a great program, and we love offering it, and the seniors.
It's very popular.
The seniors fill it up.
Even more so since we haven't had it for a few years now.
Yeah, and so we'll work on getting that out there and retraining up some additional trainers so that they can hold their own programs. But a few years ago, I think we had. We trained half a dozen or a dozen or so instructors, and we had hundreds of people out in the nursing homes and other places offering these programs. And so it was great, and it just kind of COVID just kind of it took a big hit in COVID.
I hate it.
But we'll build it back up, and it's always been a popular program, and we always look for it. And we're looking at other, now they have also a Tai Chi based type program that we're looking at as well. And so we want to continue with that, something that we've always been supportive of. Even before Santina was here, Sarah Levy, our former health educator, did that as well. And so we're happy to keep offering that.
It's a legacy program.
Yeah, that's great. I mean, prevention, and that's just, we see
so important.
So many people come in, and that's like the first step of, people fall, and then medically things just like dominoes. So if you do a little bit of prevention with falls, it's enormous.
No, and that's one of our, you may recall from our strategic plan before this one, and I think it's incorporated in this most recent one, was, one of the things that was it's slightly different from Fairfield than the regional one. The regional community health improvement plan was, essentially strategies to help seniors stay in their homes. And that was a big one. It was, so it supports us continuing to offer the Matter of Balance program. And so that's why we're, continuing to do it. We had built it up. We're going to continue to build it up again and get that going because it's really, as expressed to, in the focus groups that we had in developing that strategic plan, that community health improvement plan, that came out clearly that we, seniors want to help staying in their homes longer and being more higher functioning. So,
Great. Thank you.
Sure.
Well, we've had a busy summer down at Public Health Nursing. The big focus, as always, is processing physicals for school entry as well as for sports physicals for the high school kids, and there were hundreds of them, just piles like this on our desk, but we got through it. Also over the summer, we had several students who are new to the U.S., and we haven't had that in a couple of years on account of, immigration restrictions, but quite a few that we've seen, including about a half a dozen Ukrainian refugee students, who each and every one of them was just absolutely wonderful and won my heart. Dr. McDonald was able to perform the health assessments on all of these kids. We did a lot of, I should tell you, Sam, we used a lot of the translating services this summer to get the translation of their vaccine records. There are quite a few, I have to tell you. If they haven't had health insurance already, there's a huge program, federal program that the state's administering to get insurance, and it's just like call a telephone number and we have all that information and we just give it to the people there. Overall, we saw 46 individual children for childhood vaccines this summer. Most of them received multiple vaccines. Many of the foreign-born students had inadequate polio vaccination, which is interesting because you talk about the in the wastewater and all, and they say that it's the oral polio vaccine, which is not administered in the U.S., is given in other countries. So you kind of wonder what the connection might there be if other, people are coming in at this point. I don't know, but it's something that I think about at 3 o'clock in the morning. Many of the students had more than one visit. We also noticed that many students were referrals from private practice because vaccine supplies were inexplicably low this year. There were a couple of times when we had absolutely none left, and it was, emergent. Julie was ordering constantly just to get our supplies up. But we got it. We'll get more tomorrow, as a matter of fact. We had 5 vaccine clinics for children, primarily under the age of 5, all throughout the summer. We're giving our 3rd dose clinic, on September 21st. And as Sam says, we hope to have the bivalent Moderna only, Sam's, clinic by the end of September. And but when I sat down, I just got a message that we will not be getting the supply that we had anticipated, but we're not alone. It's a nationwide shortage of the bivalent. So we'll have what we were promised last week, which is kind of a fraction of what we had ordered, so we'll see. So those are the upcoming clinics. Thankfully, big news, we've hired for all the positions in the school nurses, for the school nurses, so we're fully booked. It does, however, represent about 20% of our school nurse staff, so we needed to get those nurses who retired last year and get them in and train the new nurses in the schools, and that's still going on. We still have, at least some of them are being followed by other nurses right now, and I'm grateful for that. As usual, we had a very busy start to the school year itself. The nurses come in a week before school actually starts. They have to ensure compliance with health assessments and vaccines and make sure the medications are in order and documentation is right. So they do a lot before kids even walk in the door. We have suspended the dental program during the pandemic, and we did a bit of a survey in the school last spring just to see what the need was like, and the need is there. At least some of the nurses at some of the schools felt that we really had to get back in there and provide the service. Most of these students are on Husky, and limited dental services are covered in Husky. But then there were transportation issues for some families, and so we just figured we'll bring it to them. That really was it. We started off at McKinley, and we have 63 students eligible at McKinley. who will be getting dental services. More applied, but they were not allowed on account of income limitations.
Sorry, so are those students that transported to a dental office, or do you basically bring like a mobile office to them?
Oh, no, we have a dental hygienist on staff, and
Oh, okay.
she has her office, and
She has a mobile setup, so she has a mobile cart with all the, tools, and it's all portable. We have that and a backup one.
That's great.
our hang-up right now is that the equipment hasn't been touched in, 2.5 years. So Wendy did inventory and she had to order quite a few things. So we're waiting on that. Hopefully that'll come tomorrow. She hopes to start at McKinley on Thursday.
Yeah, and so our dental program works that Wendy is a Husky provider, and so the cleanings that she does, she can actually bill Husky for, and so she'll do the cleanings, and then she'll come and enter it in the computer, and we actually generate revenue from that, which that revenue then pays for anybody who's in crisis with some, where they're in pain, and that pain needs to be resolved to help them learn better. Those funding kind of covers that cost of dental care. So we'll get those kids who haven't had good dental care or having problems, get them the care they need to make them more effective learners. And so it's a great program. It's just been on hold for a little bit.
Is there a formal referral in place then to get those kids that need further care to a dentist then?
Yeah.
So Wendy has a list of participating providers that are willing to participate at Medicaid rates, and so when Wendy makes the referral to the dentists on the list, gives them a list, says you can choose from any of these dentists, and just tell them you're part of the Town of Fairfield Dental Program, and they do the work, whatever they deem necessary, and then they send us a bill, and and we pay that. So out of the funds that she generates from the previous year. So
at PHM, we also had my Spot Vision vendor came in for some additional training, so we're going to be launching that next week, which I can't wait to do. Other training, Dr. Duranko and I attended the community risk assessment. Are any of you aware of that? They really publicized it quite a bit. It was down at the community theater. It was run by the Fairfield Police Department. They had representatives from the U.S. Secret Service come in and do a day-long lecture. Actually, Secret Service was in the morning, and the PD was in the afternoon. It was really worthwhile. I learned an awful lot there. And I think, it was mostly department heads, I think, that were there from what I could recognize, and a lot of school personnel as well. And so the goal is to integrate that into a broader program. And that's not ours. I shouldn't be speaking like that, but that's the goal of the PD, to do that. I mean, there were just little things that you learned. I mean, we learned about certain commonalities among these mass shooter, and it wasn't to schools, it was in the community as well. And there were certain mental health issues that you might identify with these people. They made the point that it was not predictive, that there are certainly more people with this diagnosis that would never think of doing anything like that, but this, just commonalities in the profile. And what was another thing? One of the biggest interventions, they said, was just the check-in. So they said, having the assistant principal stand at the door of the middle school and just get your eyes on all the kids that come in. It means a lot to the kids, means that, there's somebody who I can rely on, and that's a big thing, having an adult that they can confide in, talk to, discuss their issues. So I'm sure more to come from that. And of course, there's COVID. So since the beginning of the year, so we've been in school, today is Monday? Yeah. We've been in school for 2 weeks. We've had 164 cases since the start of the school year, so that's just in 2 weeks. And we had about 120 this time last year. So that's where our stats are. Despite the number of cases that we've had, we have only been able to really identify one cluster at an elementary school, and that was just done today. And we did, I'm sure you remember from last year, we did our usual thing, send the letters out to the parents, send them home with test kits, that sort of thing. Got to stop saying that sort of thing. And we're working on some other schools as well that we may have clusters coming up. And that's it. That's my report.
Great. Thank you very much. Okay. So any communications?
I have done.
Any old business or unfinished business?
We have none?
Is there any new business?
So we do have two things on the, here. The first is just for review. This isn't a vote thing. This is a Fairfield Board of Ed policy that Jill's been working on. And I'll let her describe it, but essentially they've added language, and I'll let her describe it, but it's not for vote, it's just for consideration, and the Board of Health is asked to, if there's concerns or comments or anything like that to incorporate or change, that this would be an opportunity to do so. The Board of Ed is the final voting authority on what their policies say, but it's just an opportunity to provide comment. And I'll let Jill take it over from there.
So the Board of Ed policy that we're discussing is administration of medication in schools. And I've presented this already to their policy committee, and it was approved there, and then it's going to go to the general Board of Ed vote. I think it might even be this week. Very little change, but it's really significant as far as I'm concerned. If you have the policy, it's just written in red. I described it last year at one of the last meetings for the year. And can I do show and tell?
Yeah.
I brought it, so you're going to see it.
Yeah.
We're talking about diabetic, insulin-dependent type 1 diabetic students who may experience severe hypoglycemia, and they need glucagon to recover from that. And these students are unconscious. They are unable to help themselves. They can't pop their Starburst or drink their juice box. They need help. So previously, and this is pretty remarkable as it was, but it's limited, we used intramuscular glucagon. This would come in a pre-filled syringe. You'd have to reconstitute it and then give it to the victim. I think that I would be very stressed out having to do this with an unconscious student in front of me, but I would do it. Having to do this as a coach when you've never touched a syringe in your life would be very, very difficult. People want to volunteer for it. Everyone's willing to help, particularly coaches. But they weren't allowed to by law. So what came out, by the time this law was written, since then, this came out, which is glucagon in nasal form. So you just take it out like that and put the child, on the ground, lift up their neck a bit, and you just insert it in one nostril, and that's it. And it's a powder form. It gets absorbed in the nasal mucosa, and hopefully the child will respond quickly after that. Part of the instruction, and it is a very standardized instruction from the state that we have somewhat modified. You have to give them the juice box or the Skittles or whatever they can manage soon after that, and call 911. Let me reset it so the next time I do this, I have it there. Okay. So the language that you see here is that, coaches and licensed athletic trainers during practices, games, athletic activities, they had already been legally allowed to administer epinephrine, the auto-injector cartridge,
Right.
as well as the assist the student really in the albuterol inhaler. What I find fascinating with this, these kids are awake. When you're going through an allergic reaction, you're awake and alert. Same thing with the albuterol. So I don't know how much assistance they really needed.
Right.
Maybe some with the EpiPen for sure. But the glucagon was kind of left to the side. So what we have added was they're not only allowed to do that, but they're also allowed to administer to students diagnosed with insulin-dependent type 1 diabetes who are prescribed nasal glucagon for treatment of severe hypoglycemia, which may require prompt treatment to avoid death. And the red lettering that I have here are just the only additions that I have. And I think it's great. I hope you guys can do it soon as well. I remember what happened was, I did nothing about this after I was kind of crushed last year. And then I did speak to people at the state, and I just got a notice from their lawyer saying that they did it independent of any change in the legislation, that the Department of Education just made the change, and DPH went along with it. So that's it.
My only suggestion actually related to that has nothing to do with the new language, but on page 3, everywhere in here it speaks to authorized prescribers.
Yeah.
But then on page 3, at the very top, the first paragraph, it says a written order from a physician saying that a child is capable of conducting self-testing on school grounds.
Hold on, where are you?
Page 3 at the very top, under administration.
Do you have the letter of the page? I usually,
It's just above
C.
section 3,
C.
let's see. Oh.
Mhm.
okay, the time or place, there?
Yes, time or place. So the end of that paragraph talks about the written order from the physician.
Yeah,
I might just use consistent language with the rest of the document where it talks about authorized prescribers. Just so there's not confusion or question later on if they do get a order from an APRN or a PA saying they could use it, you know? Sometimes people read things very literally and then deny things.
Yeah.
So.
okay. I will do that before it goes to the final policy then. Okay, I'll make that recommendation. But most of, I would say 99.1% of our orders come from APRNs, AEL, so, but that's right. Okay, thank you.
Mm-hmm. Oh, that looks great. This is awesome. I'm glad we're making the change.
Any other comments on that?
So this doesn't have to be, it doesn't have to be refrigerated.
No, it's a powder.
or anything, right? So it's all, and it will be, so I assume that in every school athletic event, if there is a child with type 1 diabetes.
At this point, no, we're not. We're asking, the child has to bring their own
They
supplies.
bring their own.
But as part of the training, the coach has to know where the kid keeps it. You know, is it, and it's, well, at least the one child I know who has it. I mean, responsible, they're high school kids, for one thing. You know, they keep it in their gym bag or out on the field.
So are they, I mean, in terms of their privacy, I mean, I assume that most of the students, most of the student athletes are telling the coach, yes, I have this issue.
That's part of it, yeah,
They
because
do-
we have to do the training.
Yeah, for sure, but I mean, is that, do all, I don't know, I mean, do
Never
all
had an issue with it.
kids are obviously encouraged to let their coaches know they have this, right? I don't know if it's required, but they're certainly should be encouraged, right?
I have never had that. I mean, that someone would be reluctant to share that information.
Right, I hope that
mean,
they
it's up
do.
to them.
I hope that they do, for sure.
Yeah. It just hasn't been our experience at all.
Right, and so we have to figure out, the children who have this, you know, have diabetes, they have to be made aware that this exists, and so I guess we'll have to, that's not so easy to figure out. I mean, I assume that
Oh, you mean the availability of nasal glucagon?
Just that you know, that, I mean, sure, the parents are, you know, may or may not be aware of it.
Yeah.
That obviously the pediatric endocrinologists are, and I hope that they're.
Well, actually, what we did, we have a letter that goes out to the coaches, and then to the parents. And it very specifically, I was just editing it today, it very specifically says, if you are prescribed with epinephrine, albuterol, or nasal glucagon, please, you know, get this order filled so that the coach can do it, and give it to your nurse so the nurse can do the training, and.
So you're planting that seed, basically, you know, if you have
Everybody
it.
gets it.
Yeah.
Everybody on a team gets it.
Right, that's good.
Yeah.
Yeah, I mean, it's an amazing improvement, I mean, compared to having to give the injection.
Oh, what a nightmare, huh?
Yeah,
I mean,
definitely,
I mean, I'd be.
Yeah, especially when seconds make a difference, yeah.
Okay,
That's
great.
great.
Thank you. And thanks for
So
that.
no vote required on that. The second item on the agenda does require a vote, and this is because it's a change to the Health Department's School Health Programs Policy and Procedures documents, and I'll let Jill describe that as well.
Okay, so we have had, we're given both copies of the old and the new, administration and interpretation of the TB skin test. It was old. It was way too detailed for a professional who's administering the skin test. So when I became aware of the, I think you all have that too, the Connecticut Tuberculosis Risk Assessment Guide, it really spelled out quite a few things for me. The number one thing it spelled out for me was on page 2, I believe, of the risk assessment. It's that teachers, school staff are no longer recommended to have it. And that was the inspiration, that was the motivation to change this whole policy. We have done, aside from all the physicals we did, Board of Ed did an enormous amount of hiring this summer. And we were doing tuberculosis skin tests morning, noon, and night at our office. And it was an incredible amount of work. And I asked the public health nurse who used to work prior to my even being there, like, how many times did you get a positive PPD when you were here? Not once. Not once was there a positive PPD for any of the school employees. So that really convinced me that this is a policy that we can do away with. However, the state came up with a really good risk assessment. So it's, birth, travel, residence, at least 1 month in the country, other than the U.S. or Western and Northern Europe. I mean, so all these kids who are coming in from China, all the kids from the Ukraine, obviously. I mean, from South America, the islands. We're not going to be doing a skin testing for these children anymore. We're going to be doing quantiferon testing, and that was a big change. So I wanted to incorporate that into our new policy, along with eliminating the skin test for school employees. And I tell you, we have been doing this. I didn't really need a policy change from you guys to do this. And Dr. McDonald was quite helpful in getting a standing order for quantiferon for children who are born out of the States. We certainly did it. We were handing them out to all the kids from Ukraine and certainly all the other ones that were coming in. So having said that, those were like the big changes that I wanted to do. I don't know if you guys have gone through this, but I just really wanted to streamline our policy so that it was a lot more accessible to those of us working in the office, so that we could find the answers to our questions right away, so that we could test appropriately and make referrals when indeed, the quantiferon test did come back positive. This is all for latent TB, latent asymptomatic TB. This isn't for someone who's obviously febrile and coughing and all that. I mean, we deal with those people as well. We do DOT with them, the direct observed therapy, and that's a whole nother part of it. This is just screening for tuberculosis for those kids. Really, it comes down to those kids who are coming from overseas, who are going to school in town. Mm-hmm. So what do you want to do here? Do you want me to go through the whole thing, or have you?
I think that is
what should I do?
Great change.
No, I think if there's questions, I mean, we've provided the documents, you've explained it adequately. I think it's a reasonable to take out all the specifics of, draw up, do this, all those things.
Yeah,
and
all
just
that
go
procedural
put a
stuff.
link into the CDC, attach the Connecticut TB risk assessment document as a part of the policy now, right?
That's right.
And so that clarifies it, and as this gets updated from time to time, it'll still be titled the same thing.
It's updated automatically.
It's just
We
updated
won't be
automatically.
rewriting this,
So I don't think, depending what the board decides, if you need to get any more specific than that, we can do that. If not.
I mean, we're still going to offer TST, which we're calling it TST now, tuberculin skin test, and no longer PPD. We're still going to be offering that, certainly to the nurses who come on, because healthcare workers, they at least need it, not every year. That's another recommendation. It's, upon employment to do it. So we're going to be doing that.
So nurses, yes, teachers, no.
That's right, yeah. I think it's primarily on account of nurses' exposure in the hospital setting.
Right.
That's okay. We can do it here for us as well. Because I have to tell you, most of my nurses do work off hours in the hospital. Yeah. The other thing is that we've had a long-standing practice to offering it to the members of the fire department and the police department, and we still will offer that to them based on, their risk of exposure in the town. And, we've had a number of cases of TB, active TB in the town over the years.
How about other town employees?
The sanitarians,
yeah.
I mean, yeah.
I
don't
don't
know.
know. It's never been
not a routine thing.
requirement.
I just know town of Stratford, everybody, even if you're checking tickets at the beach, you have to get a PPD. You're not even indoors, but.
Well, that's what,
I
are
think
they
that's
doing that?
kind of had happened.
That's where we were previously. I mean,
Yeah.
I
But
think
we're no longer.
this is a change now, sort of coming to
That's
a
good.
new assessment strategy.
Much more reasonable.
Yeah.
It is reasonable, yeah.
Yeah.
And, I think the first sentence on the TB risk is, Routine testings of persons without risk factors is not recommended and may result in unnecessary evaluation and treatment because of falsely positive results. And I can guarantee you that has happened. We've had, let's say, the guy who grew up in Brazil and he wants to coach soccer at one of the high schools, and he received BCG. Are you all familiar with BCG? Yeah. Okay. As a child, and he gets...
But technically, the BCG in childhood should not be showing a positive PPD in adulthood any longer. So
they say it wanes. If you're 22 and you're going to be a coach, perhaps it doesn't wane.
Yeah. I mean, I over my career, I've seen a lot of those still positive in adulthood.
Yeah.
It happens very commonly.
Yeah. I haven't really seen a full-blown positive, but we have had people who we send for a quantiferon. God forbid we send them for a chest X-ray. That would be absurd. And they come back negative.
Yeah.
So,
Okay.
we know what's going on.
Yeah.
So much better that they have that.
Yeah.
And that's how we screen everyone that starts at the hospital now is quantiferon. We don't do PPDs anymore.
You don't do them at all. Yeah.
So unless there's other questions, I'd request if I word the motion so that it's done accurately, because we're doing something a little bit wonky with changing the title of it as part of the update. Mm-hmm. So unless there's any other questions.
So just a question, I guess from a policy writing standpoint, it just seems a little odd to me, I guess, to have like a no longer clause in here, right? We're not going to routinely offer it to teachers anymore underneath the first responder piece. I mean, I feel like the policy should just say what you are going to do and not what you're no longer going to do.
I have to tell you, okay.
Because 5 years from now, that may not make sense.
Mm-hmm.
That's the only reason I bring that forward.
Yeah.
It seems weird from a policy writing
standpoint. It was such, that's a good point.
Where is that on the?
It's under testing first page right in the middle.
Yep.
Testing will be offered on an annual basis to first responders, and then routine pre-employment testing of public school personnel is not recommended. But you know what, Jason, I felt that it was such a huge part of what we were doing. Mm-hmm. And then in addition, they mentioned it in the CT risk assessment sheet itself, that I felt putting it out there was important.
Understandable.
But Jill, if we just put a period after DPH
that's what I'm thinking.
and took that last line of the second, would you be comfortable with that? So it's like routine pre-employment testing of school employees is not recommended by DPH.
Okay, I guess I was feeling rather
just like the pregnancy
emphatic about it.
Kind of a feeling to it, yeah.
Okay.
I think it reads very clearly and succinctly. This is very nice.
Yeah.
Okay, so I'll read state the motion. So, as amended, with the removal of that one line, we'd like a motion to update the administration and interpretation of the tuberculin Mantoux skin test to be the new policy, which is the tuberculosis risk assessment policy. I think that's it. We're updating the policy and we're changing the title to the tuberculosis risk assessment policy.
I'm just wondering, what we discussed that on Friday, whether or not we should kind of put that in parentheses, previously known as, or, if it's only going to be my department is looking at it, it may not be that necessary.
It's not a bad idea. I didn't know it was now being called TST either. We're still being referred.
Oh, not only that. Not only that, but that the policy itself.
Yes.
Yeah.
So to add to the title of the new policy, in parentheses, previously known as, and the title of the old policy, is what you're saying, Jill?
Yes, that's what I'm saying.
Okay.
As far as what you said, TST and PPD, those, I have those in there.
Yeah.
Okay.
Okay, so.
Does that make sense to you or no?
It makes sense to me. As long as everybody's comfortable with it. I'm the.
Have some sort of archival record of it or something.
Yeah.
Okay, because we are continuing the date review. Well, yeah, the date reviewed is continuous. States all the old dates of the old previous policy in the new policy. So, so it makes sense to me, obviously, to have that there as well. So.
No.
So.
What? Oh yeah, no.
Oh,
okay. So is there a motion to update the administration interpretation of tuberculosis Mantoux skin test to the new tuberculosis risk assessment, parentheses, previously known as, the administration interpretation of tuberculosis Mantoux skin test, with the one amendment of removing the line,
Will no longer be offered
and will no
by the
longer be offered by the Fairfield Health Department. Is there a first?
Motion to update.
All right.
Second.
Okay, you, and,
All in favor?
Aye.
all right, the motion
Thank you
passes.
very much.
Mhm.
Thank
Okay.
you very much.
We're getting more
That's a lot of work.
efficient here.
I know.
Great, so was there any other new business?
There was no other new business.
Any comments or anything we discussed? Otherwise, can I hear a motion to adjourn?
Motion to adjourn.
Okay,
Okay, thank you.
thanks very much, guys.
Thank you.